Hello there, it's Dr. DeMaio. We are doing the reproductive system, and that will include male and female, primary sex organs, which are the gonads, and the cells that they produce called the gametes, the sex hormones that's produced by them, androgens in the males, estrogens and progesterone in the females, and we'll discuss the accessory reproductive organs, ducts, glands, and external genitalia. So the male reproductive system, the male gonads are the testes. Gonads are the testes. They produce sperm and lie within the scrotum. Okay, here's the scrotum here. Testes are within the scrotum. The sperm are delivered to the exterior through a system of ducts, starting with the epididymis, following into the ductus deferens, or the vas deferens, same thing, into the ejaculatory duct and the urethra. The accessory glands empty their secretions into those ducts during the ejaculation. And they include these glands that produce some of that seminal fluid are the seminal vesicles, the prostate gland, and the bulbal urethral glands. So here's a sagittal section of a male. Of course, this is posterior. This would be anterior over here on this side. And you can see the anatomy, the basic anatomy. You can see the scrotum, and you can see the testes within. This is the epididymis, and this would be the ductus deferens, or otherwise known as the vas deferens, going up. And then this right here would be the covering of the bladder. That would be the bladder here, and this goes up into and shares a route towards the exit with the seminal vesicle. So the sperm is going to come up. It's going to go through the same route here. Seminal vesicle is going to add to it, and then we have the next gland here, the prostate gland, will add to that fluid. And prior to the actual fluid being ejaculated during the beginning of coitus, your bulbal urethral glands will start producing a viscous fluid, and that will help to lubricate and cleanse the tract. We'll talk about the actual external genitalia and all its components as well. So here's another image from the front, and you can see how this is your inguinal ligament here, and you have this inguinal canal coming down, and the male's testes are outside of the body. So, and there's a reason, because it lowers the temperature by 3 degrees centigrade, and that will have an effect on the sperm being able to develop properly. So you see coming through this inguinal ligament, and alongside of it is the inguinal canal. And then you see coming down through it, you see your blood supply, your nerve supply coming down. And you can even see how the vas deferens is coming up from the testes, and it's going to go into the seminal vesicle and then the prostate, which you can't see in this image because it's deep. And then it would go out through the ejaculatory duct. So here's another image. This is showing you the scrotum, of course. The scrotum has a superficial fascia, and there's two muscles basically associated with the testicles. One is the cremaster muscle. That's a skeletal muscle that can raise the testes up and pull it up. And there's actually a reflex, a neurological reflex called a cremostatic reflex that you can test on a patient to see if they have damage to the sacral nerves. And then there's another muscle, I believe it's a smooth muscle, called the dartos muscle. And that's what wrinkles the testes. And so you see this spermatic cord here within the inguinal ligament and the inguinal canal. And within that, you see all these different structures coming down and going up. You have your arterial blood supply coming down and your venous return going back. And then you have the ductus deferens, or another name, as I said before, the vas deferens, which is going to carry the sperm up. Okay, now there are coverings around the testes. So you have the tunica vaginalis from the peritoneum, the tunica albuginea of the testes, and the females have a similar covering around the ovaries, believe it or not. And then there's, of course, a fascia deep inside there. There's an external spermatic fascia, and then there's a internal spermatic fascia. So again, the scrotum, the sac of skin and superficial fascia that hangs outside the abdominal pelvic cavity at the root of the penis. Now that, if you just saw what we saw, the fascia and the skin and the tiny, very thin, smooth muscle around it, and it has the different layers. It's not very thick, and patients who have had surgery for to try and stop the sperm from going up into the vas deferens, they would, sometimes the doctors would have them put ice on their testicles, which is not a good idea. The testicle is very thin. If you put ice on it, it can only be for a few minutes, maybe 4 to 8 minutes at the most. I would stick to more like 4 to 6 minutes. I had an experience in the hospital. I may have told my students presently about a guy who came in after getting a vasectomy to try and block the sperm from going up so he wouldn't get anybody pregnant. And he had blood all over his pelvic region, you know, on the towel and stuff above him. And the doctor came in and said, "Oh, we're going to keep the ice on." The ice had already been on for an hour. The poor gentleman had been on blood pressure meds. They never took him off it, so he was bleeding. The bleeding did not stop. Because when you use ice for more than 15 minutes on any body part, it will cause more dilation of the blood vessels instead of what you're trying to do, constrict the blood vessels and stop the bleeding, reduce inflammation. And he had it on for an hour. He probably actually damaged his testes for life. So the sac of skin, very thin superficial fascia around it with very thin muscle. It contains the paired testicles separated by a midline septum, right and left, separating the right and left. Its external position keeps the testes 3 degrees Celsius lower than core body temperature. And that's not Fahrenheit, so you have to do the math. It's more than 3 degrees Fahrenheit. So you want to keep them cooler so that it's better for sperm production. The cooler temperature allows better sperm production. You may have heard when a couple is trying to have a baby, they tell the husband to wear boxers so that it doesn't increase the temperature of his testicles. The intra, that's inside, the scrotal temperature is kept constant by 2 sets of muscles. That dartos is a smooth muscle that wrinkles the scrotal skin. So it can keep the temperature, you know, normal. So if we went into really icy cold water, it causes the scrotum to shrink up in a sense, and the wrinkled muscle around it causes it to pull the scrotum closer to the body wall to warm it. Hence the term shrinkage when someone goes into cold water. And then you have the cremaster, which are bands of skeletal muscle that elevate the testes. They can actually pull the testes up too as well. So each testes is surrounded by 2 coverings or tunics. You have the tunica vaginalis and the tunica albuginea. I don't know if I pronounced that word right. You may do it better than me. But here's the tunica vaginalis right here in white. And then the tunica albuginea. Tunica vaginalis is here on the outside, and the tunica albuginea is more in white. You can think of albino if you want to remember that. It's more of the white one. The septa divide the testes into right and left, and there's 250 to 300 lobules within the each individual testes, and they all contain 1 to 4 seminiferous tubules. Okay, so this is the lobules here in green with the septa separating them. And then there's seminiferous tubules. The seminiferous tubules are going to be coming out from the lobules, and then they're going to go into, they produce the sperm. First of all, the seminiferous tubules produce the sperm, and they converge to form a tubulus rectus. Here's the tuberous rectus right here, and which is coming close to the next thing. It's going to bring the sperm into the rete testes. Here's the rete testes. So the tuberous rectus coming from the seminiferous tuberals come into the rete testes, and then the rete testes are going to bring the sperm to the efferent ductules and then enter the epididymis. So this is all epididymis here. Okay? And so surrounding the seminiferous tubules are interstitial cells that produce the androgens. So surrounding inside microscopically, there are cells called interstitial cells. So if someone was to ask you which cells produce the androgens or the testosterone in males, which cells produce testosterone in males? There it is. The interstitial cells that surround the seminiferous tubules. Androgens means testosterone, right? The testicular arteries branch from the abdominal aorta and supply the testes. The testicular veins arise from the pampiniform plexus, right? So it doesn't really show you. You saw it on the other image. And then the spermatic cord encloses the peripheral nervous system and the central nervous system nerve fibers, blood vessels as well, and lymphatics that supply the testes. So you'll see that the peripheral nervous system, I'm sorry, did I say peripheral? The parasympathetic nervous system, excuse me. The parasympathetic nervous system and the sympathetic nervous system supply the testes. And each one has a specific role. What is the role of the parasympathetic versus the sympathetic? As far as the main job of the gonads is not only to produce hormones and sperm, but also to copulate and procreate. And during that copulation, the sexual act, one of these parts does one thing and the other one does the other. So I want you to give yourself a little gestalt for a minute to think about it. Which one do you think does what? Well, we'll find out. So the copulatory organ is the penis in the male. It's designed to deliver sperm to the female reproductive tract. It consists of an attached root, a free shaft that ends at the glans penis. Here's your glans penis, here's your shaft, and the attached root is in this region here. There's a prepuce or foreskin in males that's usually cut off during at birth, and that's called circumcision when they remove that foreskin. In the female has a prepuce too that's analogous to the foreskin in the male. And then so the surgical removal of the foreskin is usually done right after birth. The internal penis has a urethra and 3 cylindrical bodies of erectile tissue. So in the center is the urethra. You can't really see it on this image, but you have the notes at home, and I highly recommend you, when you do watch these videos, you take out the PowerPoints that I gave you already, and you put it right next to it, maybe print it out right next to it, and you could take notes. But the urethra is going down the middle, and surrounding it are 3 cylindrical bodies of erectile tissues. So the erectile tissue is a spongy network of connective tissue and smooth muscle riddled with vascular spaces. During the erection, here it is, the parasympathetic nervous system, during sexual excitement, it causes the erectile tissue to fill with blood. And that causes the penis to enlarge, become rigid or hard due to the engorged blood within. And the corpus spongiosum is the first layer around the urethra, and then it expands at the very end to form the bulb of the penis or the glans penis. So that has spongiosum as well as in there. So surrounding the actual urethra is a cavern. It's a very small cavern. It helps to make keep the urethra open. That's one of the jobs of that, is to help keep it open during the erection. It also is erectile tissue. It gets filled with blood and also engorges at the penis head as well, because that's all spongiosum. And then the corpora cavernosum are paired dorsal erectile bodies on the dorsal side of the penis, and they're bound by a fibrous tunica albuina. So you have two more erectile bodies besides the spongiosum. So there's your three pairs there. The crura is the proximal end of the penis surrounded by a muscle called the ischiocavernosus muscle, and that anchors the penis to the pubic arch. That would be all up in here. You can't see it on this image, it's so tiny. But here you can see the ischiocavernosus muscle right here. So that's pointing to the ischiocavernosum muscle. And then this is another important muscle in the sexual act called the bulbospongiosus muscle. That's the one that causes the ejection of the sperm and seminal fluid. It's a better term is seminal fluid. Of course, there are other muscles here, but these are the muscles. The ischiocavernosum is the one that helps to keep it firm against the body wall, and it's the one that can actually move the penis during times. Male can make it come, besides being erect, it can actually move it up as he's contracting that muscle. And this muscle should only contract when you eject the sperm. The male sexual response or erection is an enlargement and stiffening of the penis from the engorgement of erectile tissue with blood. So during sexual arousal, and there's a whole section that I've taught on the sex act. If you want, I could actually send it to you guys if you want it. I'm not going to ask it on a test, just what's in this PowerPoint. But during the sexual arousal, the parasympathetic nervous system, that's parasympathetic nervous system, reflex promotes the release of nitric oxide. And the nitric oxide causes the erectile tissue to fill with blood. And this is why drugs like Viagra, they're designed to deliver nitric oxide to this area. So the nitric oxide causes the erectile tissue to fill with blood. The expansion of the corpora cavernosum compresses their drainage veins, so it doesn't allow that blood to release for that period of time. So it retards the outflow and maintains the engorgement. The corpus spongiosum functions in keeping the urethra open during ejaculation, as I said already. Okay, so there are, in male and female, there are accessory glands that function, and they're important. So the seminal vesicles, which is found right here, that's the seminal vesicle right here, and that vesicle lies in the posterior wall of the bladder and secretes 60% of the semen. So the semen is the fluid. It's a viscous alkaline fluid containing several things, but fructose, ascorbic acid, and a coagulating enzyme called vesiculase, and also prostaglandins. Now, why the heck do you think you need fructose, ascorbic acid in the seminal fluid? Well, that's to support the sperm for its long trip across the ocean. It's been said by my biology teacher at Nassau Community College when I started. I think it was my first biology course. He had in his mind, the trash bins of his mind, he called it. He had all kinds of facts and factoids. And he said that the distance that the sperm has to travel to arrive at the fallopian tube area is equal to you or I swimming across the Atlantic Ocean to Europe. And he said the trip is just as violent. So you need food, you need stuff to keep you alive on that long trip. And then there's enzymes that coagulate, and you have enzymes and prostaglandins associated with different things that are going to occur. Because during selection, as the female selects the right sperm to fit in, there's going to be a processing of the sperm as well. And then the sperm at the head has an acrosome with enzymes that are going to break down the walls around each egg, the egg that it's trying to, so they all work together to break it down with those enzymes. So speaking of the seminal vesicles, 60%, this is important on test because we're going to go through the percentages of what is inside, and we'll look at 3 different glands and their contribution to the percentage of seminal fluid. So you see that the seminal vesicle is supplying 60% of all those fluids. So most of the fluid of the the semen or seminal fluid is actually from the seminal vesicles. And the seminal vesicles will join the ductus deferens to form the ejaculatory duct. So you're going to get sperm from the ductus deferens coming up. Remember we said the sperm is coming from in here. It's going to be going up, and it's going to meet the seminal vesicle, and we'll see how much of that fluid is actually sperm. We know 60% is from the seminal fluid, from the seminal vesicle, but how much is sperm actually? So we go through here. We have one more gland to talk about, and of course the prostate gland. That's a very important gland in males. The most common cancer in males is prostatic cancer. It's a donut-shaped gland that encircles part of the urethra inferior to the bladder. Here it is right here. And this is the bladder up here, right? Here's your seminal vesicles right here. And here's your prostate. Here's your ductus deferens coming up. This is all bladder. This is the ureter coming down into the bladder. Okay. So the prostate gland is a donut-shaped gland that encircles part of the urethra inferior to the bladder, below the bladder. It's milky, slight acidic prostatic fluid which contains citrate again, enzymes again, and prostate-specific antigen. Of course, there's all kinds of prostaglandins in it. That's how they got the name prostaglandins. And it counts for 1/3 of all the semen. So how much is 1/3? About 33%, right? That true? Okay, so we got 60% from the seminal vesicle. This was 60%. Now we got 30 to 33%. You can say 30 to 33 or 1/3, right? And it plays a role in the activation of the sperm. And it enters the prostatic urethra during ejaculation. So here's the prostatic urethra right here. So everything together, you have the sperm coming up, the seminal fluid coming in, and then you have the prostatic fluid coming from the prostate in that prostatic urethra. We have the bulbal urethral glands. The bulbal urethral glands are tiny pea-sized glands inferior to the prostate. And by the way, females have a very similar gland as well. They produce a thick, clear mucus prior to ejaculation that helps to neutralize the acids and neutralize the traces of any urine that's in the tract. And it also helps to lubricate the gland's penis prior to entrance. During the male sexual response, the erection is initiated by sexual stimuli including touch, mechanical stimulation of the penis, erotic sights, sounds, and smells. The erection can be induced or inhibited solely by emotional or higher mental activity. It's been said that the brain is the largest sexual organ for both males and females. So your emotional or higher mental activity can either induce it or inhibit the sexual response. So your state of mind. Impotence is the inability to attain erection. So during the ejaculation, the propulsion of semen from the male ductus system, that's what that is. At ejaculation, the sympathetic nerves serving the genital organs cause the reproductive ducts, accessory organs to contract and empty all their contents. The bladder sphincter muscle to constrict, preventing the expulsion of urine during that time. And the bulbal spongiosus muscle is the one that undergoes rapid series of contractions, forming the propulsion of the semen from the urethra. So let's talk about the semen again. So semen is the milky white sticky mixture of sperm and the accessory glands. We said 60% from the seminal fluid from this seminal vesicle. And we said 30 to 35, 33% of the prostatic fluid from the prostate. But sperm makes up how much? 5 to 10% of the total semen. So here's the question. If someone's had a vasectomy, will they still ejaculate fluid? Of course, because only 5 to 10% is sperm. The only thing you're blocking when you do a vasectomy is that sperm going up that vas deferens from the testes. It gets cauterized at the testes. So one amount of normal ejaculate with both the sperm and the seminal fluid and the prostatic fluid may contain 40 million to 600 million sperm. Yeah, but it's only 10% of that fluid. Yes, and also guess what? It depends on the time, the volume, and the length of time it's stored before ejaculating, how many sperm are in there, right? And then the quantity of sperm produced will only cover the head of a pin. That's how microscopic it is. So it's a very small amount of actual sperm compared to the rest of the fluids that are being ejaculated. Samples can be used for medical study or used for in vitro, can be obtained without intercourse through masturbation, and also there's non-reactive condoms that can be used to obtain that sperm. Let's talk about the female reproductive system. Let's give them equal time, huh? So here's the female, and this is the anterior on this side, that's the posterior on this side. And you can see your general organs here. And if you notice, this is anterior and this is posterior, keep an eye on where each organ or gland are located in relationship to each other. So right away you can see this is the vagina here, there's your uterus. I'm sorry, excuse me, did I say that? This is the bladder here. This is the urinary bladder anteriorly, and this is the urethra coming out. Okay, so here is what is this called, guys? That's your uterus, and there's the vagina, and this is the intestine and the rectum. See how easy it is to make that mistake? Don't make that mistake on your lab test and identification or in the lecture test, because both will have information about the general anatomy and the anatomy. So the ovaries, let's talk about this. Is the primary female reproductive organ is the ovary. The ovaries produce female gametes, ova or eggs. They secrete the female sex hormones, estrogen and progesterone. Now we have accessory ducts, internal and external genitalia. So the accessory ducts include the uterine tubes, the uterus and the vagina. The internal genitalia includes the ovaries and the internal ducts. The external genitalia is the external sex organs. We're going to look at this. Let's look at the ovaries first. The blood supply is from an ovarian branch of the uterine artery. And there's a fibrous tunica albuginea surrounding it. And if you look at this image here, you can identify, and I actually had underlined all the things I want you to identify here. The germinal epithelium on the outside. And my glasses here. It is germinal epithelium right here. Then you have the fibrous tunica albuginea. Is it shown here? I don't think they show it on this. Okay, so then we have embedded in the ovary cortex are the ovarian follicles. Each follicle consists of an immature egg called an oocyte. Okay, so these are all follicles here. See these little tiny guys here? There's follicles surrounding it, right? All these follicles surrounding all around. These follicles are immature. They're not quite mature yet. So the follicles are cells that surround the oocyte. The follicles are oocytes that are premature. They're not mature yet, and they're surrounding the outside area. So then the cells around the oocyte are called follicle cells, one cell layer thick. Then you have granulosa cells when more than one layer is present, and then primordial follicle, which is one layer of squamous-like follicle cells of the oocyte. So here's the primordial follicle. Oof, primordial follicle right here. Let me just erase this because it gets a little messy after a while. Okay. And use a different color too. I think it'd be better to see it. So the primary follicle, not the primordial, but are two or more layers of cuboidal cells. So let's look for the primary follicle here. Here's the primary follicles right here. So you notice there's not just a single layer, it's got 2 or more layers of cuboidal granulosa cells around it. Then you have a secondary follicle, which has a fluid-filled space between the granulosa cells, and it forms a central antrum. Here's the secondary follicle. You see it has a fluid-filled space in between there. Let me erase that. Come on. See the space in between there. So that's your secondary follicle. Your Graafian follicle is the secondary follicle at its most mature stage, and it bulges from the surface of the ovary. So here is your Graafian follicle right here. See how it's bulging out here? That's the most mature stage. An ovulation would be the injection of that oocyte or the ripening of the follicle, and it gets released into your peritoneum. It doesn't go directly into the fallopian tube, but it will eventually go through the fallopian tube through some processes that we'll talk about. So here, this is showing you a corpus luteum, which is what's left after the follicle ruptures. So after this guy leaves, you're left with these corpus luteums. So now we're going to talk about where that egg's going to go eventually, and how does it get inside the fallopian tube, which is the site of fertilization. So the uterine tubes or fallopian tubes receive the ovulated oocyte and provide a site for fertilization, like I just said. They empty into the superolateral region of the uterus via the isthmus. So this is the uterus here. Okay, this whole thing. Superolateral would be over here. It makes sense because that's where the uterine tube ends up, right? So the uterine tube expands distally around the ovary, forming the ampulla. So distally, it's going to form this ampulla here. That's the distal portion of the tube. And it ends into a funnel-shaped ciliated infundibulum. Here it is, the infundibulum with cilia shape, like a cilia, little hair-like structures. And those finger-like projections are called fimbriae. The uterine tubes have no contact with the ovaries, and the ovulated oocyte is cast into the peritoneal cavity, actually. But the beating cilia of the fimbriae create a current to carry the oocyte into the uterine tube. So they're going to have these cilia within the fimbriae that are going to wave and beat, and it's going to pull the egg in, creating a current for pulling it in. The oocyte is carried towards the uterus by peristalsis now within the tube and the ciliary action of the cilia. There are other non-ciliated cells that keep the oocyte and sperm nourished and moist. The term mesosalpinx is the visceral peritoneum that supports the uterine tube. See here, right here? So this material between here and here is called the mesosalpinx. Okay, next. So here's another picture of the uterus. And you can see the mesosalpinx here. And then this is called the mesometrium. And we're going to discuss the different layers. We're going to talk about the layers of the uterus. So you have an outer layer, and you have an inner layer, and a middle layer. So you have a perimetrium, a myometrium, and an endometrium. The endometrium is the inside wall. Oops, let's erase that a little bit. The endometrium is the inside wall. The myometrium is the muscular wall, and the perimetrium is the outer wall of the actual uterus. And then this is called a mesometrium, and it helps to form this big broad ligament along with the mesosalpinx, and the mesoovum will form a broad ligament. You have several ligaments we're going to talk about, and we'll go over those in a few moments. You have a uterosacral ligament, Okay, and I know somebody who had their uterosacral ligament removed, detached, because they were getting a lot of back pain during menses, which is insane, and then they had difficult pregnancies because of that, because now the uterus can't be suspended well. There's always a payback, you know, when you remove parts of your body. So let's look at the uterus. It's a hollow, thick wall organ located in the pelvis. It's anterior to the rectum. Here's the rectum. So it's anterior. This is the anterior side. This is the posterior side. You're looking at a sagittal section. So the uterus is anterior to the rectum and posterior superior to the bladder. This is the bladder. So it's posterior superior and anterior to the rectum, posterior superior to the bladder. Here's a normal uterus. It has different parts. You have the fundus at the top. You have the body of the uterus, which is most of it. And then you have those different layers, the endometrium, myometrium, and doesn't show you the perimetrium. You have the cervix, which is at the bottom of the uterus with an os. The os is the opening. Okay. This right here is the vagina, and this is the fornix of the vagina, which can be very important in certain conditions. The fornix of the vagina. We'll talk about that. So let's get back to the uterus. The uterus has a body. That's the major portion of it, right? So here's the body. Body of the uterus. Okay. It has a fundus, which is the rounded portion. That's the fundus. And it's superior to the entrance of the uterine tubes. Here's the uterine tube entrance right here. And then the cervix is the narrow neck which projects into the vagina inferiorly. This is the cervix. And there's the opening, the os of the cervix right there. There's a cervical canal within. Okay, so there's a cervical canal within there, kind of like you had the prostatic urethra in a sense, but this has nothing to do with urine, right? This has to do with getting the sperm into the space where the baby's going to develop. The baby will develop inside the uterus. And then the uterine walls have to be ready for it. Most of you girls know this. The guys may know a little bit about it. Okay, so the cervical glands secrete mucus that covers the external os, which can block the sperm's entry during mid-cycle. So there are glands that produce a mucus to cover the cervical os, and it helps to form the hymen type thing. The hymen is usually broken in mature women, but it actually acts like a hymen when the mucus builds up during the cycle, when you're not ready to have a baby, or the walls are not ready to be for full development of the baby. The mesometrium is a portion of the broad ligament. We saw that before. This is the mesometrium here. Okay. The lateral cervical ligaments extend from the cervix and superior part of the vagina to the lateral walls. Okay. There it is. The uterosacral ligaments are paired ligaments that secure the uterus to the sacrum. I don't know if that's on here. Let's see. Uterosacral ligaments. Yep, there it is, right there. And then you have the round ligaments, which bind the anterior wall of the labia majora. So I don't think the round ligaments here. That's right, because we're cutting through. We cut through that, and the labia majora is down here, right? So the uterine wall is composed of 3 layers. This is important, okay? So you have inside the uterus, the 3 layers. We have the perimetrium, the outermost serous layer. It's a serous layer of visceral peritoneum. The myometrium is the muscular layer. It's made up of interlacing layers of smooth muscle. And the endometrium is a mucosal lining of the uterine cavity. It has numerous uterine glands that change in length as the endometrial thickness changes. Now, inside that endometrium, you have a stratum functionalis and a stratum basalis. and they go undergo cyclic changes. So the functionalis undergoes cyclic changes in response to ovarian hormones and shed during menstruation. That's the layer that sheds. The stratum basalis forms a new functionalis after the menstruation ends. It's all associated with your hormones. Here's your endometrium. So you see this is the myometrium, the muscular wall. This is the beginning of the endometrium with a stratum basalis. And then this is the stratum functionalis that's going to get thicker and thicker until menses, and it will shed off again. And I always say it's like farming. You're preparing the soil to plant the seed. The vagina is a thin-walled tube lying between the bladder and the rectum. It's extending from the cervix down and out to the exterior body. The vagina, there's a urethra embedded in the anterior wall. Let's see our urethra. That's the urethral orifice right there. The vagina provides a passageway for birth, menstrual flow, and is the organ of copulation. The wall consists of 3 coats: a fibrous connective tissue called the adventitia, a muscularis with a smooth muscle, and the inside lining mucosa. It's a stratified squamous epithelium. We've talked about that at labor, about the throat and the mouth, and how it's a stratified squamous epithelium so it can withstand friction. The hymen is a mucosa near the vaginal orifice that forms an incomplete partition. The vaginal fornix that I showed you before is way up just on either side of the cervix within the vagina. And let's see the internal image. This is it right here. So this is your vaginal fornix right here on either side. There are a lot of documented cases of women getting damage to this vaginal fornix from sex, believe it or not. And they can get infections, and it can be so damaged and break down so much that there are some cases where the internal organs are coming into the vagina because of that damage. So this is a sagittal view again, so we're looking at the anterior here. So you see this is the symphysis pubis, the pubic bone. Here is the clitoris at top. This is showing you the labia majora, and this is showing you the labia minora. Here's the entrance of the vagina, and there is a vestibule as you're coming in, like a vestibule of a home. Then you come into the vagina, vaginal canal. There's the fornix on either side of the cervix. Here's the cervix. That's the os opening. This is the inside of the uterus, and this is all the uterus right here. Okay. So let's look at the vulva or pudendum. We have 2 slides on this. The vulva includes the mons pubis. That's this area, this mound with fat and hair on top of it. The labia clitoris, it's right here, which is homologous to the male's penis, and the vestibular structures. So let's talk about the mons pubis. It's a round, fatty area overlying the pubic symphysis. The labia majora are elongated, hair-covered, fatty skin folds, which is homologous to the male scrotum. Homologous means similar in origin and everything to the male scrotum, like the testes, right? Not the testes, but the scrotum of the testes. The labia minora is a hair-free skin folds that are within the labia majora, and they're homologous to the ventral penis. So the labia majora sometimes are the outer, people who say the outer lips, and the labia minora are the inner lips. Which one has hair? Only the outer, the inside doesn't, so it's more sensitive. Remember, if you learn from the skin in the chapter 5, that any type of skin that does not have hair has more nerves for sensitivity. Like your lips and your mouth are very sensitive. And same thing with the labia minora are the same way. So you see this area is called the vulva here, right? And it includes these different main structures here. So you have your mons pubis, your clitoris. We'll talk about that a little more as we go along. You have the outer lips here. They're calling inner and outer lips, but the outer lips are the majora here and the minora are here. and then there's a urethral opening in the middle, and then here's the vaginal opening, and there will be a vestibule. This is the perineum down here, and then the anus would be over here. So when we talk about this pudenda or vulva, the vulva or pudendum is has the greater vestibular glands, these pea-sized glands flanking the vagina, which are homologous to the male's bulbal urethral glands we talked about. And they help to keep the vestibule moist and lubricated. That's the opening as you come in. This is the vestibule right here. It's hard to see it on this image, but you have the notes. This is the opening before you're going to enter the vaginal canal between oh my gosh, the inner lips, and then you have this area, and then that's surrounding the vaginal opening before you get in there is the vestibule. And so those glands are found there. You can find the duct of the greater vestibular gland right alongside here in that area, is producing that mucus to help lubricate. The clitoris, which is homologous to the penis, has erectile tissue hooded by a prepuce, like the males had a foreskin, and the exposed portion is called the glans of the clitoris. The perineum is the diamond-shaped region between the pubic arch and the coccyx. So you have the perineum is that diamond-shaped region there. So the mammary glands are the breasts. They're modified sweat glands consisting of 15 to 25 lobes that radiate around and open at the nipple. The areola is the pigmented skin surrounding the nipple. There are suspensory ligaments attaching the breast to the underlying muscle fascia. And then there are lobes. The lobes contain glandular alveoli that produce milk in lactated women. Compound alveolar glands pass milk to the lactiferous ducts, which then open to the outside. And that is the end of our lecture on the reproductive system. Thank you.